Man suffering from MS gains hope after watching stem cell documentary. Many people who suffer from multiple sclerosis would classify it as an invisible illness. Some have few, if any, visible signs of the disease, while others show obvious symptoms like being unable to walk on their own. The man in the following story suffered more serious symptoms of MS, and he gave up the idea of ever being able to walk again. That was until a documentary changed his entire life. No control of his legs. For a decade, Roy Palmer had no control of his legs. The 49-year-old from Gloucester, England, had multiple sclerosis, MS, which results in the body's immune system eating away at the protective covering of the nerves. Collapsing out of bed. Palmer first noticed something was wrong when he developed a fizzing sensation in his legs, which gradually got worse. One day when he was getting out of bed, he collapsed as his legs were unable to support him. Getting a wheelchair. This eventually caused Palmer to get a wheelchair, and his wife Helen took on the role of caretaker. According to the National Multiple Sclerosis Society, MS is an unpredictable, disabling disease of the central nervous system. Genetic predisposition. MS disrupts communication between the brain and the body and caused Palmer to have no feeling in his legs, forcing him to use a wheelchair. While its cause is still unknown, scientists believe the disease is triggered by an as-yet unidentified environmental factor in a person who is genetically predisposed to respond. Life-changing documentary. Most people with MS are diagnosed between the ages of 20 and 50, with at least 2 to 3 times more women than men being diagnosed. Palmer suffered for 10 years before watching a BBC documentary with his wife in 2016. BBC's Panorama. In the documentary called Panorama, the couple saw how 2 MS sufferers' lives were transformed after having hematopoietic stem cell transplantation, HSCT. They watched as the patients were wheeled into the hospital, only to be walking when they got out. Hematopoietic stem cell transplantation. We sat on the sofa and we both cried, and we thought, well, if they can do it, Helen told BBC. After being moved to tears by the program, Palmer asked his general practitioner if he was able to try the treatment. Inquiring about HSCT. Palmer learned that HSCT attempts to reboot the immune system, which is responsible for damaging the brain and spinal cord in MS. According to the National Multiple Sclerosis Society, in HSCT for MS, blood cell-producing stem cells, which are derived from a person's own bone marrow or blood, are collected and stored, and the rest of the individual's immune cells are depleted by chemotherapy. The process. These stored cells are reintroduced into the body, then migrate with the bone marrow and over time produce new white blood cells. Eventually they repopulate the body with immune cells. HSCT basically involves taking stem cells from a patient who then undergoes chemotherapy. The goal of HSCT. The chemo is given with the aim of destroying the immune system before the stem cells are reintroduced to build a new, healthy immune system. The goal of HSCT is to reset the immune system and stop the inflammation that contributes to the active relapsing MS. Experimental therapy. The entire process takes anywhere from 3 to 6 months, and although HSCT has been shown to be effective at treating certain cancers and MS, it's still considered an experimental therapy. It's also been linked to severe kidney, liver, and lung complications. Risks. While there are a number of known risks and toxicities associated with HSCT, the most serious is the risk of death. The main risk comes from the chemotherapy regimen used to reduce or deplete the immune system. This makes the patient vulnerable to many infections. But despite its risks, Palmer wanted to try the treatment. Effectiveness. He discovered that he was the perfect candidate for HSCT since he had highly inflammatory, relapsing, remitting MS and has had it for 10 years. Still, the effectiveness of the treatment would vary according to Palmer's individual characteristics and the intensity of his treatment. Beginning the treatment. If the patients on the documentary can have that done on a trial, why can't I have it done? Palmer said. So in 2017, Palmer started the grueling treatment. Let's hope it works, Palmer said in a home video taken just before the treatment. A success. Thankfully for Palmer, the treatment worked. After HSCT, he regained feeling in his left leg within 2 days. I haven't felt that in 10 years, Palmer told BBC. It's a miracle. He eventually regained feeling in both of his legs and began to walk. Given a second chance. He said that the support from the nurse was absolutely fantastic and attributed to his recovery. I've been given a second chance at life, Palmer said. Since recovering from the surgery, Palmer started volunteering at his local police station. Trip to Turkey. Thanks to his life-changing surgery, Palmer's enjoyed his first stroll on the beach during a holiday trip to Turkey. Little things like that, people don't realize what it means to me, he told BBC. Besides traveling, he's enjoying the little things in life that most people take for granted, like dancing. Videos of Palmer participating in the Kiki challenge and flossing have gone viral. While most people take part in these trends without thinking too much about it, Palmer is rejoicing in being able to dance as he wasn't able to before MS. Promising treatment. The MS Society says HSCT is a hugely promising treatment that's had amazing results for some people. But since it requires patients to undergo chemotherapy, it can do more harm than good if a patient has a lot of nerve damage. Favorable odds. The society added that its risk is decreasing as more people have the treatment. Despite being favorable odds, 1 in 100 patients who use HSCT will still die as a result. But for patients like Palmer, it can prove to be hugely successful. Check out these other videos from Let Me Know. If you haven't made the move to subscribe to our channel, all you need to do is click on that red subscribe button. Thank you for watching.